You need to watch this if you struggle with chronic diarrhea. We've all experienced diarrhea at some point, that urgent need for the restroom and uncomfortable loose stools. But when diarrhea becomes a recurring issue, lasting for weeks on end, it's classified as chronic diarrhea. This goes beyond a simple upset stomach. Chronic diarrhea can significantly impact your quality of life, disrupting your daily routine and even affecting your overall health. It's crucial to understand the causes of chronic diarrhea to find effective solutions. While occasional loose stools might be nothing to worry about, persistent diarrhea can signal an underlying issue. In this exploration of chronic diarrhea, we'll delve into its common causes, discuss ways to manage symptoms, and highlight when it's crucial to seek medical advice. Knowledge is power, and understanding your body is the first step towards reclaiming your digestive well-being. Sometimes the culprit behind chronic diarrhea is closer than you think. It could be lurking in your diet. Certain foods and ingredients can wreak havoc on your digestive system, leading to chronic diarrhea in some individuals. One common culprit is lactose intolerance, a condition where your body struggles to digest lactose, a sugar found in dairy products. If you experience bloating, gas, or diarrhea after consuming milk, cheese, or ice cream, lactose intolerance might be the cause. Gluten, a protein found in wheat, barley, and rye, can also trigger digestive distress in people with gluten sensitivity or celiac disease. Beyond specific intolerances, certain eating habits can also contribute to chronic diarrhea. Consuming large amounts of greasy or fatty foods can overwhelm your digestive system, leading to loose stools. Artificial sweeteners, commonly found in diet drinks and processed foods, can also have a laxative effect, contributing to diarrhea. Identifying your dietary triggers is crucial for managing chronic diarrhea. Our digestive system is a complex ecosystem home to trillions of bacteria that play a crucial role in digestion. However, sometimes harmful bacteria, viruses, or parasites can invade this delicate balance, leading to infections that manifest as chronic diarrhea. Bacterial infections, often contracted through contaminated food or water, are a common cause of diarrhea. These infections can range in severity from mild cases of traveler's diarrhea to more serious conditions like salmonellosis or E. coli infection. Viral infections, such as the norovirus or rotavirus, are notorious for causing outbreaks of diarrhea, often accompanied by vomiting and fever. Parasitic infections, while less common in developed countries, can also lead to chronic diarrhea. These infections are typically contracted through contaminated food or water or contact with infected soil or animals. Identifying the type of infection is crucial for determining the appropriate treatment, which may include antibiotics for bacterial infections or antiparasitic medications for parasitic infections. While dietary triggers and infections can cause temporary bouts of diarrhea, chronic diarrhea often points to an underlying medical condition affecting the digestive system. These conditions can range from common disorders like irritable bowel syndrome, IBS, to more serious diseases like inflammatory bowel disease, IBD. IBS is a common functional disorder that affects the large intestine, causing symptoms like abdominal pain, bloating, gas, diarrhea, and constipation. While the exact cause of IBS is unknown, factors like stress, diet, and gut bacteria imbalances are believed to play a role. IBD, on the other hand, is a group of chronic inflammatory conditions that affect the lining of the digestive tract, including Crohn's disease and ulcerative colitis. Celiac disease, an autoimmune disorder triggered by gluten consumption, can also cause chronic diarrhea. In celiac disease, the body's immune system attacks the small intestine in response to gluten, damaging the lining and impairing nutrient absorption. Recognizing the signs of these conditions is vital for seeking appropriate medical care and managing symptoms effectively. Finding relief. Managing diarrhea symptoms. Dealing with chronic diarrhea can be incredibly disruptive and uncomfortable. While addressing the underlying cause is crucial for long-term relief, several strategies can help manage symptoms and improve your quality of life. One of the most important steps is to stay hydrated. Diarrhea can lead to dehydration, so replenishing lost fluids and electrolytes is essential. Over-the-counter oral rehydration solutions, or ORS, are specifically designed to replace lost electrolytes. But you can also sip on clear broths, sports drinks, or water with a pinch of salt and sugar. Certain foods can also help solidify stools and reduce diarrhea. The brat diet, consisting of bananas, rice, applesauce, and toast, is a classic remedy for its blandness and binding properties. Other helpful foods include cooked carrots, white potatoes, and lean protein sources. Avoid caffeine, alcohol, and fatty or spicy foods, as these can worsen diarrhea. Hydration is key, staying safe and preventing complications. Diarrhea causes loss of water and essential electrolytes. Electrolytes are crucial for fluid balance and muscle function. Severe dehydration can lead to complications like dizziness and kidney failure. Staying hydrated is paramount when managing diarrhea. ORS provides the right balance of sugars and electrolytes. You can find ORS at most pharmacies. When to seek help. Recognizing warning signs. While most cases of diarrhea resolve on their own, certain warning signs need prompt medical attention. Persistent diarrhea lasting longer than 2 days could signal a serious condition. Seek immediate care if you experience high fever, bloody diarrhea, severe pain, or dehydration. Early diagnosis and treatment are crucial for managing chronic diarrhea and preventing complications. Section 8. The doctor's visit. What to expect. When you visit your doctor for chronic diarrhea, they will likely ask you a series of questions to understand your symptoms and medical history. Be prepared to discuss the duration and frequency of your diarrhea. How long have you been experiencing diarrhea, and how often do you have loose stools? Your stool characteristics. Are your stools watery, loose, bloody, or greasy? Any accompanying symptoms? Do you experience abdominal pain, bloating, gas, fever, nausea, vomiting, or weight loss? Your dietary habits. What do you typically eat and drink? Have you noticed any specific food triggers? Recent travel history. Have you traveled to any areas with a high risk of foodborne or waterborne illnesses? Your medical history. Do you have any pre-existing medical conditions, allergies, or medications you're currently taking? Based on your symptoms and medical history, your doctor may recommend further investigations such as stool tests, blood tests, imaging scans, or endoscopy to determine the underlying cause of your chronic diarrhea. Section 9. Taking charge. Lifestyle changes for digestive health. Incorporating lifestyle changes can improve digestive health and reduce symptoms. Diet plays a crucial role. Keep a food diary to identify triggers. Eliminate dairy, gluten, fatty foods, artificial sweeteners, and caffeine. Focus on bland, easy-to-digest foods. Manage stress with exercise, yoga, or meditation. Stay hydrated. Get 7 to 8 hours of sleep. These changes can improve your digestive well-being. Section 10. Long-term solutions. Working with your doctor. Managing chronic diarrhea is often a journey that requires collaboration with your healthcare provider. They can help determine the underlying cause of your symptoms, recommend appropriate treatment options, and work with you to develop a personalized management plan tailored to your specific needs. Treatment for chronic diarrhea varies depending on the underlying cause. For example, if lactose intolerance is the culprit, your doctor may recommend a lactose-free diet or lactase enzyme supplements to aid in digestion. If an infection is detected, antibiotics or antiparasitic medications may be prescribed. For chronic conditions like IBS or IBD, your doctor may recommend a combination of medications, dietary modifications, stress management techniques, and lifestyle changes to manage symptoms and prevent flare-ups. Remember, communication is key. Don't hesitate to discuss any concerns or questions you may have with your doctor. They are your partners in managing your chronic diarrhea and improving your quality of life. Section 11. Your gut feeling matters. A recap and call to action. Chronic diarrhea is more than just an inconvenience. It's a sign that something is disrupting your digestive system's delicate balance. From dietary triggers to infections and underlying medical conditions, identifying the root cause is crucial for finding effective solutions. Remember these key takeaways. Listen to your body, pay attention to your symptoms, and don't ignore persistent diarrhea. Seek professional help. Consult your doctor for proper diagnosis and treatment. Take charge of your health. Make informed choices about your diet, stress levels, and lifestyle habits. Your gut feeling matters, and taking proactive steps to address chronic diarrhea can significantly improve your overall health and well-being. By understanding the causes, recognizing warning signs, and seeking appropriate medical care, you can regain control of your digestive health and live a fuller, healthier life.